Corvallis and Albany, and I have the privilege of co-chairing the Oregon Women's Health and Wellness Alliance with these three great leaders who are each going to talk to you a little bit today. The Oregon Women's Health and Wellness Alliance has been meeting for over 2 decades. It is a bipartisan coalition of individuals, organizations, and legislators that are focused on policies that will help improve women's status in the state of Oregon by improving their physical health, their safety, and their access to economic opportunity and economic justice. And so when we build our priority list each year, we try to focus on each of these areas. There are many priorities that come to us, many good ideas that each of us and members of the organization certainly support. When we build our priority list, we try to look at those that this organization can provide a little extra encouragement and support for, and that really fit into that frame of supporting women to advance in these areas. So we have worked hard with that group to identify our priorities for this legislative session. I'm really excited for you to hear about them, and Representative Barbara Smith Warner is going to outline them.
About the priorities, but they're categorized, as Senator Gelser mentioned, in 3 broad areas: women's health, women's safety, and women's economic well-being. You see, there's about 10 to 12 bills. There still could be there still could be some last-minute additions, with yesterday being a filing deadline. But you'll see, we really like to categorize them so that we can kind of focus on each of those areas and demonstrate the breadth of issues. I mean, just in women's health, it ranges from notification in medical marijuana facilities and other places about the health impacts of marijuana on pregnancy, to, in addition to dental, another bill on dental referrals to pregnant women, to working with women's veterans and making sure and finding out whether they are utilizing the health services they deserve. So it's the broad range of women's health issues. On women's safety, the issues, as you can see, I really do like to point out that these are bicameral and bipartisan, that you see sponsors of both parties on these bills because of the broad influence that women share across the spectrum on these issues. The use of sick leave or personal business leave for victims of domestic violence, harassment, assault, and stalking, to improving access to justice for campus sexual assault survivors. Again, across the spectrum of women, in ways that impacts their safety and their ability to live productive, meaningful lives, and to feel safe in them. And then finally, women's economic well-being. While there are a number of bills and priorities that are going to happen this session on other issues that will affect a lot of women, whether it's minimum wage discussions, paid sick leave, we focused in the Alliance on specific issues that apply to just women. While we are fully supportive of many of those other efforts, we wanted to focus the Alliance's work on things that specifically and only apply to women. So there are a range of economic well-being issues, mostly that target domestic violence, but with additional areas as well. So with that, I believe I'm going to turn it over to Senator Steiner Hayward, who's going to talk a little further about Survivor that we have here with us today.
She's not here. She's on the freeway. Okay, let's regroup. Representative Kenny Geyer, what are you going to talk about?
Okay. Looking forward to her hopefully getting here. But I will say that we've talked a lot about women's health, economic well-being, and safety. And the reason that this alliance started 22 years ago in 1993 by Senator Diane Rosenbaum, Kate Brown, I forget if she was a senator or representative back then, and many other, both Representative Carolyn Tomei, is because women's health and well-being had not been high priority issues in the legislature where the majority of people were male. and it was very important that we really focus on these issues, both because women's health and well-being had not had the priority, but also we know how important it is for all of Oregon and Oregon's next generation because of the disproportionate share of responsibility that women have in caring both for younger children and for elder people. And so because women are at the forefront of being caregivers and really the rocks in their communities, it's really important that we devise policies that support women. So it started 22 years ago. It's continued to gain steam since that time. We just had a kickoff breakfast this morning with over 50 people. We will be meeting every 2 weeks in the legislature. Senator Elizabeth Steiner Hayward co-chaired it last year with Representative Sarah Gelser when she was still representative, and when she came over to the Senate, they both still wanted to do it. We wanted a strong House presence, and I think, again, this is one of those alliances that has just grown in strength. We now have 4 co-chairs as a result. The number of people who are on the mailing list continues to grow. We encourage anyone that wants to be on the mailing list to contact Senator Elizabeth Steiner Hayward's office to get on that mailing list. We have, through OLIS, the Oregon Legislative Information System, for people internally connected on that, a way to track the bills. We also have a Facebook page. So we're really encouraging people to give feedback to these kinds of ideas, as well as to support, to really link these policies with people in the community who are facing these issues. And the other thing I will say again, both in the effort to be both bicameral and bipartisan, 6 of the 12 bills that we have in this agenda right now have Republican and Democrat co-sponsors. The other 6, as bills go along and get hearings, they will continue to collect, so they may only be supported by members of one party right now, but we very actively seek to have co-sponsorship and support from members of both parties. So I know that we also want to get to a point where we're going to answer questions about specific bills if you have questions.
And may I add one? All of these people all across the state, and the people that do that aren't the 4 of us. Right. They are our extraordinary staff that I know were up really late last night, stuffing packets, working really hard, tracking us down to make sure that we had our materials ready. So pretty much anything that happens in this building would not happen without the really talented, hardworking, dedicated, brilliant staff. So thank you to all of you for getting us ready to be here today.
Do questions. We were going to, I'll just say that the person we hope to have with us and may yet is a woman named Diana Camarilla, who's worked very closely with is a sexual violence program coordinator. And one of the things that we want to point out is that sexual and domestic violence are leading problems for women still in the state of Oregon, unfortunately really across the world, but and they affect not only one's physical health in terms of the damage that comes from the assaults, but also emotional health. They increase risk for a variety of things like metabolic syndrome and long-term economic well-being. So addressing issues like domestic and sexual violence have a significant impact on women's overall well-being and also, therefore, the well-being of our communities and particularly our children. So that's why one of the reasons that OWHWA has always chosen to focus on addressing this issue as best as we can. So I think, Mr. Mapes, you're the only one.
Only one. Well, I did. If you could talk a little bit more about the
Sure, I'm happy to do that. There are a couple of places that we want to focus on. The first is that although Oregon has contraceptive equity in our laws, we don't have any provisions currently to address the gaps that were incurred through the Hobby Lobby decision by the Supreme Court. And this bill would start to help to address that if women are employed by employers who choose to exercise the freedoms that were granted to them by the Supreme Court and therefore have limited access to kinds of contraception that we know are really important in preventing unintended pregnancy. And preventing unintended pregnancy is very important for women's long-term economic well-being because an unplanned pregnancy is one of the leading indicators for women not completing their education. And to that end also, this bill will also promote allowing women to receive 12 months at a time of contraceptive prescriptions, whether that's birth control pills or patches or some of the other reversible contraceptives that many women find very effective. It's very hard for a lot of women, especially working women or students, especially if students are out of state, to get prescriptions refilled every month or every 3 months. So getting a year's worth at a time of something that we know will continue to prescribe for them is a way to help prevent unintended pregnancy and address that issue. It will also start to address gaps in preconception care. We know that being well prepared and being healthy before one becomes pregnant can really increase the likelihood of a healthy pregnancy, help avoid preterm birth, and promote good outcomes for Oregon's babies. And right now, preconception care has sort of spotty coverage, and we want to be sure that women understand the importance of getting in for great care before they get pregnant. Representative Kenny Geyer mentioned, or Representative Smith Warner mentioned, the dental health bill. This is also included a little bit in the comprehensive bill. That's very important because we know that poor oral health also contributes to poor pregnancy outcomes and increases risk for preterm birth. It also increases risk for diabetes down the road. So there are a lot of aspects in here that just fill in some of the gaps, and that's really what we're trying to do, is to ensure that every Oregon woman has access to first quality health care throughout her lifespan.
So you said that there was some
exact details, but basically the state would help set up an insurance plan that women could buy into, or that insurance dollars could be used for, that would help cover those kinds of contraception. It's unfortunate, frankly, from our perspective, that that was the decision that the Supreme Court made. It doesn't seem right to me personally, and Oregon made this decision a long time ago. In 2007, when we passed contraceptive equity in Oregon, thanks in large part to the efforts of people like Senator Rosenbaum, now Governor Brown, and others in this alliance, that we made the decision that employers who, under very limited circumstances, were a religious organization who primarily hired and served those of the same religious persuasion, were allowed to opt out of the contraceptive equity mandate. But that's a much more limited subset than the Hobby Lobby decision allows. And so women who would have been covered under Oregon's contraceptive equity law, in theory, would not be covered. So we want to help protect those women.
And there was I think somebody had told me in advance, there's an abortion-related provision in that bill as well.
I think it also just relates to making sure that women have access to coverage for abortion as part of routine insurance care, which, again, we consider part of routine women's health care. And we're proud that Oregon is one of the states that doesn't have restrictions on that. We want to make sure women have access to full-scope reproductive health services.
But I thought that was already the case. So once again, how does that change the law?
It only changes it in the sense that, again, some employers have the right to not include that in their insurance coverage, and we don't want women to be limited in their insurance coverage based on their employer.
Okay.
Unfortunately, it seems as if our wonderful friend who would be joining us may not be able to make it with us today, which is really too bad, the joys of commuting between different parts of the state up and down I-5. But we would like to thank everybody in the Alliance for their active participation. Although all of us come at these issues from different perspectives, the point about an alliance is that we can support each other, we can learn from each other, and we can add to the conversation about so many of these important issues. We know that when women are healthy, when women have good jobs, that our whole community thrives and improves. And so the goal of the Women's Health and Wellness Alliance is to create a stronger Oregon by creating stronger women. And we thank all of you for the time you've taken to come with us today. Anything else?
Any other questions?
I guess the only, I just was looking at the one on the prohibits possession of firearms on misdemeanor crimes. So what is it? I thought domestic violence was already covered. Is that only for felonies?
There are actually, yes, and there's some gaps between Oregon's law on this and the federal law, and there are also some issues related to the fact that currently Oregon law only allows for removal of firearms if the person who is allegedly committing the domestic violence is a spouse or intimate partner, as opposed to if it's a child or a sibling or something like that. So we want to protect people from domestic violence. We want to keep guns out of the homes of people who are known to be involved with that, regardless of the relationship within that household.
Is this a new concept as a bill, or has this been introduced in the past? I'm wondering.
I don't know the answer to that question, actually.
Yeah, that's going to run into the...
Can I?
Please.
So I think one of the things that's important about this bill, it really aligns Oregon to allow us to implement what's already federal law. These individuals are prohibited from owning firearms at this point. This allows us to implement that.
I see.
It codifies
Yeah.
I think two different provisions that are in federal law that are not yet in our state statutes.
So in that case, it's not new. It's important, but clean up.
Okay, thanks.
So thank you all so much for taking the time to attend, and we appreciate all the work that everybody's doing to support
And I'd
these
like
bills.
to recognize Representative Carla Peluso.
Oh,
who is
yes,
here, who is
Representative
one of
Peluso. How nice.
Who is a sponsor of one of the bills on the Alliance's agenda.
Yep.
So thank you for
Great.
joining us.
Thanks.
Thank you all very much.